So 1 out of 4 people across the world will die of diseases related to coronary artery disease. ST elevation myocardial infarction, or STEMI as we call it, or heart attack as we know in common language, is killing more people globally and in our part of the region than any other disease. WHO statistics are that as we are speaking and going forward in 2020 and 2025, overall mortality from cardiovascular diseases, specifically myocardial infarction, would contribute to around 25% of all global mortality. So 1 out of 4 people across the world will die of diseases related to coronary artery disease, and specifically myocardial infarction is the most common killer here. So globally speaking, the standard of care in the developed world is opening up of coronary arteries during myocardial infarction by primary angioplasty. Having worked overseas, I saw it happening day in and day out, and how precious lives were saved by primary angioplasty. If we try to bring the Western model to our country and our systems and our geographical areas of our working, they will not work because of the distance, economic constraints, inavailability of cath lab. Primary angioplasty cannot be made available to a vast majority of our population, and that's a goal that we should not set for ourselves. So we should get some systems and develop some systems that work best in our own environment. I believe that STEMI India model is something that has been shown to work in some states of our country. It's already existing and a running model, and if we can just tweak that same model to suit our state and the northern part of the countries, in which you have a combination of primary angioplasty where it is available, thrombolysis plain where it is available, and combining both the two in a pharmaco-invasive approach, and try to develop a system that every patient, irrespective of the fact which place he is in, gets the standard of care, at least what is available in that setup, and then can be transferred to a place within 24 hours to get him the best of international class of STEMI care. And that system has been shown to reduce mortality. And if we can implement the same system in the rest of the country, and why to just talk about our own country, there's a large part of the population, of global population, residing in third world countries. If you can just implement the same program in places where primary angioplasty is not widely available for whatever reasons, economic or functional inavailability of trained manpower, I think this system will work well. And just because this is the single largest killer, even a small dent in mortality would result in much higher numbers of lives saved in our regions, lives which are young, precious, economically and socially viable.